If you are currently experiencing pain on the outside of your knee, there's a good chance it could be related to your IT band. So it may not actually be your knee itself. Now, if you've been to see someone about your pain, there's a good chance they've also diagnosed you with IT band syndrome. If they have done, then maybe they've given you some exercises or some foam rolling to do for the outside of your thigh. But in today's video, I'm going to explain why the advice that you've been given is wrong and what you could do about it instead. So quite often patients come in to see me and they say they've got IT band problems or IT band syndrome. They've often been given foam rolling exercises to do for the outside of their thigh. But the reason I think that that is wrong is because the IT band is essentially a big, thick, long tendon. Now, by foam rolling that tendon, all you're going to do is irritate it. And by foam rolling it, you're not going to create much change. You're not going to cause a lengthening of that tendon. In order to get that tendon to change, it's going to take years. So let's just say we've got pain on the outside of our knee. That pain is probably due to tightness along this IT band. Fine, that's probably true. But rather than trying to release the IT band, we need to think, where is that IT band connected? So there's two muscles that attach to the IT band. The first is the tensor fasciae lata, which is at the front of the hip. And then the second is your gluteus maximus muscle. So if you just look at how my trouser leg is affected by me squeezing here. So if this is the insertion point and I'm squeezing with my left hand, you can see it affects lower down. So if we're trying to release this IT band, rather than trying to release the tissues down here, if we can let go of some of this contraction up the top, that's going to take some of that pressure off the IT band lower down. So what we need to do, instead of working the outside of your thigh, which is just going to be painful and it's going to cause you irritation and pain, what we're going to do instead is trying to release the TFL, the tensor fasciae lata, and the gluteus maximus muscle. And I'm going to show you that right now. So what you're going to need for this is a lacrosse ball or any other massage ball, but personally I prefer lacrosse balls. So bring your lacrosse ball to the front of your hip. Now, if you can find the bony part of your pelvis, there's like a bump at the front, just drop the ball just underneath that, roll onto your front and get some pressure on that muscle. So what you do from here is move until you can find a tender point. Once you find a tender point, then just stay on that point. There's no point rolling around up and down like this, because all you're going to do is cause pain and irritation. So instead, what we're going to do is roll, look for a tender point, press, and then just hold. And you can hold this for 20 seconds up to 60 seconds. But do your best just to relax. Just focus on your deep breathing. Just nice and controlled, nice and slow. Relax into that. After about 20 to 60 seconds, then you can slightly turn just to find another tender point, move around. When you find another tender point, hold and repeat. And you can keep doing this all the way around the front. And what you're doing is working from that bony part of your hip here, down towards this bumpy part of your outer thigh right here. So once you've used the ball and you want to now stretch the TFL muscle, what you need to do is find something that you can kneel on, a towel. In this case, we've got a squishy block. Kneel on it with the side that you want to stretch. So in my case, I'm stretching my right and I'm in a kneeling position. Now, quite a lot of the time, what you will find is that people are telling you to do some kind of lunge movement, which is fine. But what you might find is actually that starts to stretch your quads or your hip flexors, although the TFL does slightly flex the hip. But to target it more specifically, what you need to do is to shift this front foot across and then shift your hips across as well. So we're taking the affected side more underneath us. So from here, you should have your hip pushing out and then you can slightly lunge forward as well. Now, a couple of points just to make is that when you are lunging forward or while you are kneeling, what you need to do is to contract your abs and squeeze your buttock muscles. That's going to stop your lower back from arching. So you're in this position and you contract your abs and contract your glutes. So your back is nice and straight. Then from here, you are shifting to the side and lunging forwards as well. So back from the front view, you're in this lunge position. Shift your front foot across, drive your hips across as well. Contract your abs, squeeze your glutes, and push your hips forwards. So you should be feeling that right in here. Once you can find that stretch and you feel it, hold that for 20 to 60 seconds and then repeat on the other side. Now maybe only you've got one side affected, but it certainly won't hurt you to do the other side as well. Now last but not least, to stretch your gluteus maximus muscle, what you're going to do is the side that you want to stretch, lift your foot, place the outside of your shin on top of the other knee. Then with your hands, grab your knee and then lift the knee up and towards the opposite shoulder. So from here, you're going to bring it up and over until you can find a stretch going through the buttock here. Once you've got the stretch, hold that for 20 to 60 seconds and just focus on your breathing. So there you have it. That is the stretch for the gluteus maximus, which is the muscular attachment of the back of the IT band. So now we've worked the front and the back. If you can release those two muscles, then you're going to have a release of tension going down the outside of your thigh, and therefore it's going to take some of that pressure away from your knee. So there we have it. Hopefully now you've got a couple of extra techniques that you can do to relieve your outer knee pain or your ITB tightness. Hopefully also that's going to save you hours of useless rolling on the outside of your thighs, and it's going to save you a lot of pain as well. Let me know in the comment section below how you get on with these, and let me know if you were doing rolling on the outside of your thigh and how much this has helped you in comparison. Now that you understand that, go away and practice that, and I will see you in the next video.